how long have you had the problem?
I've had headaches for 25 years.
Yeah.
I started breaking my teeth when I was 20, 21.
Yeah.
Driving to my first interview for medical school. I broke my first tooth. And it was after that, when I had my first crown put on, that I started getting headaches.
Did you wear braces?
Just recently.
Recently?
6-7 years ago.
Okay. Did that improve the situation or make it worse?
Didn't change it.
Didn't do anything?
Didn't make it worse.
But you've been breaking teeth consistently over the years?
Since the very first one.
And the headaches, the evolution of the headache?
They've gradually worsened. They started after I broke the first tooth and had the first crown put on. And I had constant problems with it, couldn't keep it on, had a porcelain crown to start with, broke it.
Yeah.
Then I started having, not headaches all the time, but headaches weekly.
Yeah.
Depending on how much stress I was under.
As a physician, describe it. Would you call it a tension type, episodic, a chronic migraine? What?
It became chronic, no different than migraines. I have migraines that are very different from these.
Okay.
But it became constant. Felt like somebody had a hot poker stabbing me in the back of my skull.
Right.
Up at the top of my neck, base of my skull.
And
something that, if somebody could just poke, I would make my husband dig his fingers in it as hard as he could.
Almost like a trigger point.
Kind of. But they'd been injected, it didn't help.
So who did you see?
I've seen neurosurgery, I've had C-spine fusion, had progressive problems from that, have upper level stenosis that they couldn't explain why that happened.
Yeah.
Neurologist, several primary care doctors, several chiropractors,
and
massage therapists.
Did you ever see a dentist about it?
Just breaking my crowns.
Yeah, right. So
saw several dentists.
What'd they try to do for you, if anything?
Give me new crowns.
That's it?
Mm-hmm.
So you'd break one, they'd fix one.
Mm-hmm.
And then you'd have trouble with that.
They'd have a terrible time making my bite be right,
Yeah.
because they have a terrible time getting the crowns to fit.
Yeah.
There was always a problem with making my crowns fit. Couldn't keep them on. I super glued so many of them on. It was crazy.
For real?
Mm-hmm.
Yeah. So they never tried to fit you with a splint of any kind?
I had splints.
And what'd that do for you?
I broke the splints.
Numerous splints?
Chewed through them, yeah. Broke them, broke my retainer.
Nice.
Mm-hmm.
Okay. So about, 2 months ago, you had broken a tooth on your bottom right,
Mm-hmm.
and we'd kind of just gotten acquainted to one another. And we were
Right.
at dinner, and you mentioned this, and you were going to go try another dentist that was supposedly high-tech.
Right,
in
the
the city
dentist that
north
had
of
worked
us.
with my son. I've done some
Yeah.
porcelain overlays.
And he has good marketing, so you thought
Right.
this is the guy.
Possibly.
Yeah, so,
I'd had a really bad experience with a crown with the dentist that I'd been going to. I'd gone to the same dentist for many, many years who did something bad happened with my daughter with him, so we switched dental offices, and I'd used the same one for probably 3 years.
yeah.
And had a new crown put on that there was just one thing after another. And she was ready to send me for a root canal on that crown.
Right.
So that I'm not going back there.
Gotcha. So you never got the root canal on that crown.
Mm-mm.
So come to find out, months later, no root canal, right?
Probably not.
Yeah.
You didn't tell me I needed a root canal,
Right.
so I
Yeah.
guess not.
So you came in with a busted, I think it was lower right molar,
Mm-hmm.
and I did some of that weird stuff that I do with the digital technology.
Mm-hmm.
And after I just did one tooth, I made mention to you that there was an issue in there that was occlusal based, bite based,
Right.
muscle bite teeth.
Right.
When you left, did it make a difference for you?
Yeah. It was
Aside from
amazing.
the crown.
No, it was amazing. Yeah, I came in thinking I was getting a new crown.
Yeah.
2.5 hours I might have been there, and as I left the office, that horrible severe pain that I've always had back here was completely gone. When I woke up the next morning, all of my right-sided headache, jaw pain was all completely gone, and I've never had it come back.
Okay, and
Not
that
at
was about 2 months ago.
Mm-hmm.
So then you found time in your busy schedule to come in about a week ago,
Mm-hmm.
and we optimized the rest of your bite.
Mm-hmm.
So did you notice a difference there?
Yeah.
What did it do?
Even that day before I left, my jaws weren't sore and tight. I always have this horrible tight,
Tension.
just terrible misery. My teeth hurt. Can't chew gum. Can't chew on ice. Nothing because my teeth hurt too bad, and my
Okay.
jaws immediately quit hurting. And by that next day, all of my occipital headaches were gone
Really?
and have not been back.
So the past week you've been headache free?
I have some lower neck stuff that's I think residual spasm, but yeah, all my headache per se is gone.
So, and it's getting progressively better?
Mm-hmm.
Is that fair to say?
Yeah, everything's getting better. I have a little frontal, like maxillary soreness.
Yeah.
I think from my new front bite, but
Yeah.
other than that, no, it's all.
Yeah,
all
at the
better.
end of the procedure of the DTR, we tend to make the forces happen more anteriorly.
Mhm.
So it takes time, 4 or 6 weeks, something like that.
Mhm.
People
Learning to
adapt.
talk has been
Yeah,
the biggest
it's a little
adjustment. Yeah,
And you got some real canines again.
yeah.
So
Showing my true color, showing my fangs.
what why do you think, why didn't you hear this before? Why did you never put that together, the headache and the dentist? I'm just curious.
I don't know. I mean, I knew a lot of it was from clenching.
Yeah.
I assumed it was all just from stress and that I just clenched my teeth.
Yeah.
That's all I've been told. Get a different bite guard. I had, you name it, every kind. Soft, hard, top, bottom, wire.
Yeah.
I broke every single one of them. It didn't matter.
Or
I'd wake up my mouth was so sore in the morning because I'm sure I'd ground all night on the bite guard too.
Sure. Is your range of motion better?
With
your neck?
Mm-hmm.
So it's like normal.
Yeah, and I don't think.
So now you
I still have a little grinding in my neck too, but even that's better.
Yeah. So now it's like I don't really think about it.
No.
Is that fair?
I sleep through the night. I don't wake up with a headache in the morning.
Wow.
No, it's
pretty cool. So
100% better.
What kind of questions, if any, do you have? Like, do you want to know why or how? I mean, what?
I guess how do you identify who the right person it would be for?
Yeah.
Would probably be one thing.
Experience. Lack of something called anterior guidance. In other words, front teeth are designed by nature to take a load when we chew to the left and the right. And when we lose that timed guidance and back teeth rub too much too long, it basically stimulates brain neurologically to crank up muscle. So the efferent response back out of the muscle is like heightened, and the muscle's always working, and it never gets a break. And the only time it gets a break is when all of a sudden you rebuild the machine, add to it, subtract from the back, add to the front, whatever you need to do to make that efficiency come back. So when the timing is right, all of a sudden brain is pleased. I mean, this is a simplistic way of looking at it, but basically, you know, you're not contracting as much, you're not spewing out excess lactic acid, you don't have an ischemic condition in the muscle any longer. You know, the oxygen, you know, rejuvenates the muscle, the trigger points disappear. It's the genesis, the root cause of the problem. So friction between back teeth over time is the cause. And the problem is mainstream dentistry just believes the statement, but I use it to great effect every day. And it's been in the research for almost 30 years. And basically, we need to defer to Dr. Kerstein, because now it's his turn. Come on, you up. And you guys go after.
Thank you for coming and
Thank you.
helping us. You asked about how you would identify a person.
Right.
So from a physician standpoint, it would be really through the things they describe, the locations of their discomforts, which you aptly described, your tension in your jaw, headaches that would be in and around your eyes, neck tension, chewing fatigue, strain, tension, tightness that's of non-organic nature. And they can be describing headache, or they can be describing jaw tension, or both. Maybe some earaches, maybe some eye strain. Those are the things that a patient really feels from this condition, and you felt all those things.
Mm-hmm. How about, I mean, is it more often symmetrical both sides, or is it unilateral ever?
That's a good question. I would say that jaw-wise, it can be bilateral, but headaches can show up bilaterally, but the condition that causes them is only unilateral. So if someone has right-sided headaches predominantly, their bite is problematic when they move to the right. If they have a left-sided headache, it's when their bite moves to the left because of the neurophysiology. But they could describe right-sided jaw pain, left-sided headache, and that would be a normal appearance of an abnormal state. It wouldn't necessarily be, it has to be bilateral.
Mm-hmm.
And there can be neck involvement, there may not be neck involvement. Generally there's facial involvement. Clenching and grinding is very often involved. Earaches of non-organic nature. Eye strain of non-organic nature. You know, there's no ocular nerve issues, there's no cataracts, there's no issues with vision, just the strain around the face.
Because of surrounding tension?
Because of the tension, right. Because the trigeminal nerve, the tooth socket mechanoreceptor, which causes this problem, is connected to the trigeminal nerve. So the trigeminal nerve can feed supraorbitally, infraorbitally, anterior to the ear, in the ear, mid-face, under the jaw, behind the ear, down into the neck, under here. So
perhaps there's even some connection with trigeminal neuralgia.
Yes, trigeminal neuralgia is often misdiagnosed.
Mm-hmm.
I shouldn't say it that way. Trigeminal neuralgia is a diagnosis that this condition is usually the actual diagnosis. And it's said trigeminal neuralgia, noted as that because there is no organic cause. You can take a CT, you don't find a tumor or a cyst. You can't find a mass in someone's jaw, yet they have facial pain.
How about my long-term results?
Well, your long-term results are very good
Yeah.
because studies show, there was a study done in 1995, a 10-year recall study of 102 patients who had similar treatment to you, same concept, same treatment, disclusion time reduction, probably a little less sophisticated than it is now because of the evolution of it over the last 30 years, but the same basic course of treatment. And the studies show that long-term resolution is lasting. Your teeth don't have the components on the bite surface anymore that would cause you to redevelop symptoms. Although I will say in my clinical practice, people can go through mild fluctuations where if you had, maybe you had a child who got sick or a parent who passed away or you had financial trouble or marital discord, not that your husband is, he's a wonderful guy, but you know, you may clench and grind more and that will give you some of the symptoms. But the chronic level is not there. And that study is pretty definitive. Classes of medication that were frequently being used were rarely used. All the subjects they had to be out of treatment 2 to 9 years. So they had a chance to really see, well, no longer am I taking Advil 7 days a week. No longer am I needing muscle relaxants anymore. I'm not going to the chiropractor every week to get my neck adjusted. You know, I don't have migraines like I used to. And they were able to staticize that in pretty predictable ways. So and it's what I see clinically as well. I have someone who's been treating people this way for almost 30 years. You know, the people I treated in 1992 aren't coming back in 2015 saying, you know, I really need my bite readjusted again, my headaches are all back, it's like I never had it done. That really doesn't happen. It's more like minor symptoms at times when your life is a little bit chaotic.
So the person that wakes up with a headache in the morning is probably.
Very.
I know with me, if I slept a long time, notoriously I would wake up with a headache.
Yes, that's a
that's
common finding. Or with waking up with jaw strain, tight jaw. I have to loosen my jaw. I have to run it under the hot water, or hard to open. You know, that kind of thing. That means that the person has had some form of muscle activity occurring through the night due to most likely nocturnal clenching or grinding, which is believed to be a central nervous system mediated problem, but it's definitely not. It's a tooth mediated problem for most people. As you can see by sleeping better, not waking up in the same way, it has to do with your bite more than your central nervous system.
I think it's anything, even at work before, I could not make it through 3 days in a row and wear my stethoscope around my neck every day in a row because my neck hurt too bad.
Just to have that resting on your neck.
Just to have that much.
Right.
And yes, last night was my 5th day, and about an hour before I came home this morning, I finally took it off because my neck started to hurt.
So
last night was my 5th shift in a row.
You really were able to do much more with it, even though it's not a heavy item.
No, not at all. I think some of it's just positionally, you know, that with, I'm sure my clenching doesn't help.
Well, but how much are you clenching now, would you say?
I think I'm still clenching. I'm just not clenching how I clenched before.
Meaning?
Because I'm still sore up front. I don't have the jaw pain, the maxillary mandibular pain that I had before. I don't have that constant jaw fatigue.
Right, well that soreness you feel up front is due to the change in your bite to unload your back teeth. So your front teeth aren't used to that. And they may need a little lessening of the amount of contact there. That doesn't mean you're clenching and grinding. Typically the procedure moves the forces anteriorly, as well as cuts down on the time that the back teeth engage, which is actually contrary to what's advocated as being correct in someone's bite without measurement technology. There's supposed to be more contact in back, very little contact in front, and that is the formula for actually creating the problems. So now your bite is more forward, and it needs to be a little less forceful in the front, which is a matter of touching it up some, and then you won't have the soreness anymore. So the fact you don't have the tension means you aren't clenching and grinding as much, and you probably see that. You're probably not like sitting through the day like.
No, I'm not. I'm a whole lot better.
Right. That's a common. People say to me, I can't my teeth don't clench anymore. It doesn't feel like they do it, you know, and that's part of the change.